Okay, I'm probably gonna get some backlash on this video, but I think everyone should hear this. We dentists talk a lot about dental implants and how they're so good at replacing missing teeth. And all of that is true. Dental implants are the best way to replace a missing tooth. And this is proved with research. Research shows that dental implants have the best long-term success to replace a missing tooth. And this even goes beyond that. Dental implants have come a long way, and they can do more than just replacing a single tooth. Now you can replace all your missing teeth with dental implants. Nowadays, if you end up losing all your teeth, it's not the end of the world, because we do have options that can replace all your missing teeth and make it in a way that it's not removable. We can put 4 to 6 implants in your upper or your lower jaw, and we can make a prosthesis that's never removed, that's fixed into your jaw, that's basically a brand new set of teeth. Now that being said, nothing will replace your God-given teeth. Implants will do a great job, and they're the closest thing we can get to your natural teeth, but there's nothing that's gonna be as good as your natural teeth. So if implants are so great, why am I making a video on why you shouldn't get dental implants? Well, the truth is, even though dental implants are the best way to replace your missing teeth, it doesn't mean that's the same case for everybody. So who shouldn't get dental implants? There's actually quite a few reasons we wouldn't do a dental implant on somebody. First off, you gotta understand that a dental implant involves a surgery. We're actually gonna be cutting open your gums, drilling into the bones in your jaw, and inserting a metal foreign object. Now, this foreign object is usually made out of titanium, but there are different types of dental implants. I'm not gonna bore you with all that. Now, some people simply can't react well to a surgery. I mean, some people simply just don't wanna get a surgery done. They hear the word surgery and they absolutely avoid it. And they'd rather just have someone work on their teeth and do like a dental bridge or something like that. But other people really should avoid getting a surgery if possible. One of these types of people is if you have uncontrolled diabetes. This is all part of some of the checks we do before we work in your mouth. And if you have diabetes, it's not that big of a deal as long as it's controlled. If your diabetes is under control and you've been going to your physician and everything else in your health history looks good, then you'll be fine for dental implants. But if you have uncontrolled diabetes and you're not making any efforts to improve it, then you probably should not get dental implants. And the reason is when you have diabetes, it's a lot harder for your body to recover from a surgery, and it takes time for your body to heal. And also you're more prone to getting infections. So this is a huge contraindication when we're doing a surgery, because we don't want to cause any infection or any problems with your mouth, and we want to minimize any risk as possible. And we don't want you to invest a bunch of money in something that could fail. I mean, obviously anything could fail, but this just has a higher risk of failure. Now, along with diabetes, another contraindication is if you're a smoker. If you're a smoker, just consider any work that we're doing in your mouth to be automatically at a higher risk of failure. Now, if we're doing a dental implant and a surgery similar to diabetes, this will make it harder for your body to recover, because again, when you smoke, it limits your body's ability to fight off infections, and it makes you more prone to infections, and it takes longer for your body to heal. So again, doing a surgery involving putting something into your jaw, there's a chance that that could fail, and there's a chance that that could get a big infection. Now, another factor we take into consideration is your age. Now, this may seem obvious, but a lot of people actually ask me this. If you're a child, we wouldn't do a dental implant. A lot of times a parent asks me about a dental implant for their child, it's because they're missing a tooth. Now, this usually isn't because of a cavity or something. Sometimes you just have congenitally missing teeth, or you were just born with a missing tooth. And a great way to replace that would be with the dental implant, but only when you're old enough. I usually wait till you're at least about 18 years old before I do a dental implant. And one of the reasons is when you're a child, your jaw is still developing. So you still have adult teeth coming in, you still have baby teeth coming out, your jaw is still changing in shape, and we want to wait for that to be done before we place something permanent into your mouth. Now, just like being too young, sometimes we don't place dental implants in someone who's too old. Now, just being old alone does not mean that you're not going to get a dental implant. So if you're about 85 years old and you really want a dental implant and you're really healthy otherwise, then you can probably still get one. But a lot of the times, people who are older have other health complications as well. And let's say you're 90 years old and you're missing a tooth. There are other options that don't involve a surgery that can replace that missing tooth. For example, I know a bridge doesn't have as long-term success as a dental implant, but if we're just talking about one tooth, a bridge will last quite a long time if it's done right. And you can still get a beautiful result with a dental bridge. A lot of times doing a dental implant will do more harm than good, because you're gonna have to do a surgery, you're gonna have to let that recover, and your body sometimes will take longer to heal, especially as you age. Now, some other health issues you might run into is if you have bleeding issues. If you're taking drugs that will increase the amount of bleeding that we'll see during a surgery, obviously that's something we'll check before we start. Now, we can definitely talk to your physician and see if you can go off that drug for a few days or so, just for us to do the surgery, and then you can go back on it once you start to recover a little bit. But this is definitely a contraindication, because we don't want to cause something that's going to cause a lot of bleeding and potentially make you go to the hospital or something to control that bleeding. And another reason we wouldn't do a dental implant is if you have cancer. Now again, this isn't an end of the world thing, but if you're undergoing treatment for cancer or you're taking certain medications that they give you when you have cancer, this is a major contraindication doing dental implants. Now again, if you have cancer, this is not an end of the world thing if you really want a dental implant. Sometimes you have a mild form of cancer and it can be removed and you don't have to take really any medications or undergo radiation. That is not a major contraindication to getting dental implants. But if you have cancer and you're undergoing radiation or chemotherapy and you're getting some medications, specifically bisphosphonates, this is a major reason we would not do a dental implant. Actually, this is a major reason we would avoid any dental surgery. And the reason is when you're undergoing these medications and you're undergoing this therapy, then you're at a higher risk of getting some type of necrosis in your jaw. This actually has a name and it's called osteonecrosis of the jaw. Now, usually the reason people will take these medications is if they have a condition that's affecting specifically their bones. Now, what can happen in a case like this is when you expose a bone, like when you do a dental extraction or when you do a dental implant, then that bone can die. And this is not fun. You may have to undergo some surgery or you may even lose part of your jaw if this happens. Another reason you're not gonna get a dental implant is if you do not take care of your teeth. Now, I'm gonna go over an ideal case where you would need a dental implant. Let's say you didn't take care of your teeth for a long time, you lost a bunch of teeth, and now you've rebounded. Now we're seeing signs that you're really taking care of your teeth, you're really motivated, but you already lost a bunch of teeth, but you want new ones. Well, we can do dental implants for you because we know that you're gonna take good care of them. But if you lost a bunch of teeth and we're really seeing no signs that you're gonna improve and you're really not motivated to really clean or brush or even floss or do anything, then we're not gonna do a dental implant. Just because it's not a real tooth, it doesn't mean it can't get problems. If you don't keep your dental implant clean, then it's gonna fail. You can still get some plaque, some food particles, some bacteria to go around that implant, and it can surround the bone that surrounds that implant, and it can cause some bone loss. And over the years, that implant and all the money you spent on it, it's gonna go down the drain, and you're gonna have wasted your money. And the last thing I'm gonna talk about, and the last reason you wouldn't get a dental implant, is if you lost a ton of bone. So I had a patient who really wanted a dental implant. He had an infection in one of his teeth and he lost a ton of bone around it, but he really wanted an implant to replace it. Well, we did our scans, we did our testing, and he basically had no bone left to replace that dental implant. So he would have to go to a surgeon to try to build that bone back up, which is really unpredictable when you lost a ton of bone. It's really hard to build a lot of bone back. It's still possible, but sometimes it's more unpredictable. And you're gonna be investing a ton of money just on that one tooth. Now, in a case like that, you can still get a good result with a dental bridge. I know it doesn't have as high of a success as a dental implant, but it still has a very high success rate. Thank you guys for watching. I hope you liked that video, and if you haven't already, please hit that thumbs up button and subscribe to my channel below, and I'll see you in the next video.